Welcome back to Toledo Clinic TV. Our guest is Eric Thompson. He's a pharmacist. And let's talk about drug interactions, specifically with herbal supplements. We all know that drugs interact with each other, but we may not realize that some of the things that we get over the counter can also interact.
Correct. I want to bring awareness that it's not just herbal supplements, not just prescription medications that can interact with patients' prescriptions. It's also things that people don't think about: multivitamins, calcium, magnesium, zinc. Those things can all have a major impact on antibiotics. So it's important to let your physician and your pharmacist know about any sort of over-the-counter products that you take, whether you think that it may have an interaction or not. The biggest example that I can think of for an herbal is called St. John's wort, and that has a major impact on a variety of different medications, prescription medications. Most notably, one that people think about and that we talk about in pharmacy school is birth control. If you take St. John's wort for depression, it can lower the effectiveness of birth control, can lead to unwanted pregnancies, as well as it lowers the effectiveness of a variety of different medicines. So that's one of the biggest ones that we think of. But it's important to let your pharmacist and physician know of anything that you're taking, whether it's herbal supplements, multivitamins, even aspirin and Tylenol.
What's the best way to check ahead of time? Let's say that you want to take an herbal supplement, but you're not quite sure if it's safe to do so. How would you find that out?
Just talk to your pharmacist. We have access to a variety of different resources that we can use to double check interactions. So just having a dialogue with your pharmacist and your physician is extremely important. We don't mind. We're there to help you. I love it when patients ask me, is it okay if I take this? And it's also important too to try to stick with one pharmacy, as best that you can, so that way the pharmacist there can double check any medications that you might be taking for interactions.
That's good advice.
Thanks.
Thank you very much.
Thank you.
We will be right back.